The main causes for lung cancer are smoking. Also, people are exposed to radon, and the third part is any asbestos exposure. The thing people can do to really prevent lung cancer is quit smoking. The next cause of lung cancer is radon, and so they can get their homes checked, and there are certain areas that are endemic for it. Well, the symptoms are very common symptoms, but for example, cough, if it's persistent, that becomes important. If you cough up blood, that becomes important. If you're a smoker who loses a lot of weight, that becomes important. If you get more short of breath than usual, that is important as well. Lung cancer is usually diagnosed with a simple chest X-ray. Once you get your chest X-ray and you see something, then you may get additional imaging like CT scans. There are broadly two types of lung cancer. Small cell, which is a rather rapidly growing type of lung cancer, which is not a surgical disease, and non-small cell, if you find it early, is very much a surgical disease. Those are broadly the two types of lung cancer. Small cell lung cancer is usually treated with chemotherapy. Sometimes you employ radiation as well. While non-small cell lung cancer, ideally if you find it early, you want to operate on the patient. And the operations can be usually small operations or large operations depending on what you find. At the Hayward Cancer Center, we are able to provide minimally invasive surgery. We usually use radiation therapy when we cannot use surgery. And sometimes people are too frail to use surgery. We use controlled radiation therapy, something called SBRT, to try to cut out the cancer with radiation. SBRT is a very clever treatment. It's like surgery without a knife. And the nice thing about it is, even though it's radiation, you have it only for 4 to 5 days. On the other hand, traditional radiation would take several weeks and up to 6 weeks to potentially get all your treatments.
Well, as the nurse navigator for lung cancer patients, I'm the contact person for the patients and a resource person to connect them with the services that they need before, during, and after treatment. My particular role begins after the patient has been notified of their positive pathology for lung cancer. And then I'm able to introduce myself and find out what needs they might have while they're going through treatment.